counting the days until we get back to work here. In the meantime, we have had a number of questions come in, and Karen compiled some of these, ranging from questions about lips and wrinkles and looking tired and mad and bumps and cysts and all sorts of things. And so today we're going to turn it over to our experts for a little question and answer session. And please feel free to Facebook or email questions into info@351face while we're on. We'll take the questions live. In the meantime, we will have an agenda for the rest of the week set up shortly. And anyway, thank you all for your support over the past weeks. And if there's anything we can do, please let us know. In the meantime, I'm going to turn it over to our expert team, Karen Whitney and Hoper Merz. And I also welcome Karen Lynch, who's going to moderate our session here. So go ahead, take it over.
Sure. So we've gotten quite a few questions over the past few weeks of doing Let's Have Lunch. And so I just wanted to bring some of those out. And Laura wrote, she's 32, and she says, I have a cyst on my back that I've been told is fine, but the look at it and the feel of it kind of bothers me. What should I do? And Hope, do you want to take this one?
Sure. Okay, so a cyst on the back. Typically, the most common types of cysts are sebaceous and epidermoid. These are in the skin layers. And yeah, they typically are benign and they are fine and you can leave them and you don't have to do anything with them, but they can become infected. So a cyst is like a sac and it has contents within it, some skin cells, some different things, and they may stay that way forever and be fine, but sometimes the cells in there can get infected. And then you end up with a sore red area. You have to get it drained. The sac is still in there even if you get it drained. And so once it heals over, if you ever want to remove it, what you have to do is actually remove that entire cyst wall, the wall of that sac, of that cyst. So we can do that preemptively and avoid any type of infection or just avoid it bothering you. A lot of the times it just bothers people cosmetically, and we can just remove that and then you're done with it, and it's very easy. We just do a little bit of local numbing, lidocaine mixed with epinephrine, and then that takes, a few minutes to set in. It feels like one teeny tiny little poke, and that's it. And then we make an incision over top of the cyst, and we just pull out the cyst and put a few sutures in, and your sutures are there about a week, and that's it. So it's really pretty simple and easy option to remove those.
Hey, Hope, can you just share with everybody how much you love those types of surgical procedures?
I love my lumps and bumps. They are fun to remove, I'm not gonna lie, and one of my favorite things to do. So
you might be the next pimple popper. I don't know. You're pretty about it. All right.
Well, this question comes from Dave, and he's 40, and I thought maybe Karen might want to be able to take this one. But Dave said, people are always telling me I look mad, but I'm afraid to get Botox because I don't want anyone to know that I've had it. Why look weird or different after receiving Botox?
That is a great question. And actually, I've seen patients exactly like that. And some men and women just really frown a lot. They're focused, they're intent. And so they've got these deep creases between their eyebrows, and people think that makes you look mad, angry, upset, worried, stressed. It almost never conveys a good feeling to people to see someone whose eyebrows are all bunched in like this. So the beautiful thing is that we can use Botox to relax the muscles, the corrugators and the procerus that create that frowning look. Sometimes we'll also do, for balance, a little bit of Botox in the forehead to keep things proportional. And what happens with the Botox is that it's going to take place gradually, and we can treat in a manner that there's still a little bit of movement so you don't look abnormal. Interestingly, when people quit frowning, almost no one notices that. They just notice that you look more relaxed, less stressed, less angry. So what I would say to this patient who's worried about people thinking, oh my gosh, what happened to him, is that one, the onset of action is going to be gradual. Even though he's no longer moving those muscles, any existing expression lines aren't going to automatically disappear. They will soften with time so that as time goes by, the lines are less apparent. The skin has a healing effect and can kind of heal itself as time goes by, especially with products. But he's not going to go from A to Z and look weird or different. He's just going to gradually look more relaxed. And someone who really has strong frown lines, expression lines, probably is going to want to be treated every 3 to 4 months to keep that change in effect, so that he doesn't go from having a lot of frowning action to being more relaxed. So I would definitely encourage him to come in for Botox. And while he's there, I would talk to him about skincare too, because we focus on skincare a lot for women, but men can also really benefit from products for anti-aging.
Hey, Karen, can you just answer just a quick question just related to Botox? I know that there are other neuromodulators, neurotoxins. If you could just kind of just let everybody know. I know Botox is the brand, the Kleenex brand, but with other neurotoxins out there, I just want people to know what they are and what they aren't.
Yes, we do use the word Botox, even though that is a registered trademark of Botox Cosmetic. We use that almost generically like Kleenex. It was the first neuromodulator in the United States brought to market. It's been on the market for 30 years, and most of the tests and studies on the following products were comparing to Botox. The other products are called Dysport, which is very similar, Xeomin, and then Jeuveau. So these are all considered neuromodulators. They're the same class of drug. Their action is very similar. When we're treating, they're not quite interchangeable. We're adjusting dosages based on units needed to achieve the desired outcome. And they're all good products. It's really a matter of sometimes patients have a preference for how one works. Sometimes the provider has a preference. Sometimes it's habit. I like the longevity of Botox. It's a long safety record, but I'm very comfortable using all of those neuromodulators. And they should have the same, basically the same effect on you.
Great, thank you.
Okay, and Karen, I have another question for you. This is from another man. His name is Scott, and he said he has terrible bags under his eyes, and people always tell him he looks tired, which we do hear a lot. But he wants to look and feel better, and he said also people are making comments that he might be drinking too much. So I was just wondering if what you would suggest that he should do.
He's a perfect person to come in and see us for a consultation. When you talk about the under eye area, a few things can happen. One, this skin is very fragile. It does age sooner than the rest of the face. So it might be that his skin needs improvement with products, possibly with a laser treatment, possibly with microneedling or PRP. It might be that genetically he has fat pockets. And we all have fat that cushions our eye. And as we age, the distribution of that fat can change and it can pop out and create a little fat pad. That's a surgical treatment, and we would have Dr. Mendelsohn's input on removing some of that fat. Sometimes it's actually the reverse. It's a volume loss, which won't really cause bags, but more hollowness under the eye. And so we do use injectable fillers to replace volume, or if someone has a little bit of puffiness, we can sometimes smooth out the contour. In other words, they've got a little fatty fullness, and then they have a shadowing hollow. So by going in and putting a little filler, we smooth the cheek from the under eye to the cheek area. And sometimes it's loose skin and there's just too much skin, and we do something called a lower blepharoplasty, where we're taking a little pinch of skin out from underneath the under eye area in order to get rid of the excess. So often that the approach to an under eye area is multi-dimensional, where we're looking at both skin, getting rid of any excess fat or skin, and smoothing the appearance by using fillers.
Yeah, and we'll have some more focused questions or answers regarding lower eyelid surgery. I will say one thing though, That the non-surgical modalities that Karen and Hope use to treat the lower eyelid bags, which is a very common problem, I would say we perform much fewer lower blepharoplasties than we have historically, because the injectable fillers in skincare do a really nice job of improving and rejuvenating the lower eyelid. So we'll have more on the lower blepharoplasty later.
Great.
Our next question comes from Lizzie, and she's 25. And so Hope, I was kind of hoping maybe you could do this one, but she says, I already have these lines on my forehead, and I see that my mom has very deep forehead lines too. She wants Botox, but she's wondering if she's too young, and she wants to know what you might suggest.
Okay, great. Yeah, in our 20s, we start to see, I would say that's probably the most common thing when someone's in their 20s to come in for some horizontal forehead lines. And you know what? The short answer is no, you're not too young. It is a great option to do some Botox and prevent those lines from getting deeper, or a different type of neurotoxin. But a neurotoxin's job is to relax that muscle up here, so that, you know, when you're doing your expressions and you're laughing and you're moving your forehead around, you're not creating those creases, which will get deeper and deeper throughout your lifetime, like your mom's, and you're noticing that her horizontal lines are deeper, and she probably did give you a little bit of a little predisposition to get those. But Botox is a simple treatment. We just treat you once every 3 months or so until the lines are out, and then sometimes you can extend your treatments. Another thing to think about is some skincare in your 20s. So adding a vitamin C is a great option to, it's kind of like a multivitamin for your skin to help keep it in good health and protect it from breaking down collagen quicker. So that's a good thing. Sun protection is important, and maybe coming into the office for some skincare treatments to help keep your skin young and healthy and prevent that aging process as much as possible. But I started Botox in my 20s, and you know, over 10 years later, I still don't have lines on my forehead, and that's where I first started seeing mine. So it's, come on in and we'll get you done.
Great. That's great. Thank you. And then Karen, I have a message from Caitlin. She just turned 30 in February, and she doesn't mind her lips, but she wished that they were a little bit fuller and poutier and maybe a little bit sexier. So she was just wondering what you might suggest for that.
Well, everybody knows that there's been a lot of emphasis on lip and lip filler. And the biggest worry that a patient will come to me with if they're considering getting filler in their lips is that they don't want to look extreme, overdone, like someone from LA. And it's one of the things I like about living in Cincinnati is we keep it pretty natural here. So lip fillers are an outstanding treatment for someone like her. We choose a product that's very soft, and that would be either Juvederm Ultra or Juvederm Volbella. Both of these products are FDA approved to use into the lip and lip area. And when we see a patient for the first time, and each time for a lip filler treatment, we're first talking to them about what do they want to accomplish. Do they want to really change the structure of their lips, or do you just want a little something going on that looks a little poutier, a little softer, fuller, sexier? And that helps us determine how we're going to treat that patient. It also helps us determine which product to choose. We can always start with small volume of injection, a half a syringe, which is actually 0.5 cc, which is 1/10 of a teaspoon. And so for someone who's really nervous, putting that little bit of soft filler gives an idea of what things will look like with filler without possibly being too much. Most of the time when someone gets that half a syringe at a first treatment, they like the results, and so they're coming back for a little bit more. It takes a lot of filler to get an extreme, overdone, filled look in your lips. Generally 2-3 syringes. One syringe is almost never going to be too much for someone. So she can come in for lip filler. If she's anyone who's nervous about it, please know we use topical numbing cream, which works very well to help relieve the discomfort of filler. You do have swelling the day or two after, and that's hard to avoid. We tell you how to minimize the swelling, but you do plan accordingly in case you get some bruising or in case you do swell, which pretty much everybody does.
Perfect. Well, thank you. And then maybe Hope you can answer this one for us. So Dee has been watching us every day that we've been on, and she said she has a lot of wrinkles in her skin and she's okay with that, but she doesn't like the area around her mouth. And she's not like really big into skincare. She does a little bit of moisturizer, she always has, but it's specifically the lines around her mouth that have really been bothering her since she's turned 80. And she wants to know if you have any advice for her.
Of course we do. So I would say perioral lines, the lines around the mouth, those are probably one of our #1 complaints that we get in the office. And when I explain treatment options, I kind of like to go over the reasons that those lines occur so that we can have a game plan. It's not just one simple treatment typically, although you will get an improvement with one treatment. Usually a combination of things are your best option. So #1 is a loss of volume that we get in that area, like Karen was just describing with our hyaluronic acid fillers that we can use to fill volume in the lips. We can also fill volume around the lips, so we lose volume all over our face. We lose it in the temples, in the cheekbone area, we lose it around the jawline, muscles, structure goes down. Everything kind of gathers around the mouth, influencing those lines as well. But we can always start with just a little bit of filler into these lines around the mouth area, and we put them not just into the lines directly, but in this full area here. And we don't overfill. It's not going to look ducky. We're just replacing a little bit of volume that you've lost to help restructure that area. The other thing that happens is that we have a muscle that goes all the way around the mouth like a circle, and it pulls inward. So we use it when we talk. You can see where I'm talking that my lips are just pulling in an inward motion. We use it when we're eating. I can't tell you how many times patients have told me, I'm not a smoker, I've never smoked in my life, but I have these lines, and it's not just from smoking, it's from all of our everyday daily activities. So that muscle, we can Botox it. We use a very low dosage or any neurotoxin we can put in that area and help relax that muscle so that you're not pulling too strongly. Now, sometimes some people pull stronger than others, and when we assess you, we can see if that's one of your main issues or not. But that's also a good option to add in there to reduce that muscle movement. The third thing that happens is just the quality of our skin is reduced. Our skin integrity depletes throughout the years. We lose our collagen, we lose elastin, things stretch, things are thinner. And if it's thinner and stretched, it's easier to crease in and fold with our muscle movement and our loss of volume. So skincare treatments are important. If you're noticing it now into your 80s, we're probably going to want to do a more aggressive treatment. We're probably going to want to do a dot laser. So a dot laser is a resurfacing laser, and that is something that it's effective. We will want to do multiple procedures most likely, but you come in, we do some topical numbing like Karen was talking about for the fillers. We can put some numbing on there. We let that sit, and then we do your laser treatment, which is very quick. You leave and you're a little bit red. It turns into some crusting around the lip area for a few days, and then you're probably pink up until about day 5 to 7. And you'll really notice an immediate improvement in those lines. It will continue to get better for a few months as the collagen's growing, but that's an option for skin, and we can go into that further during your consultation. But I think I'd plan on some fillers. I would plan on a little bit of Botox in that area, and then also some skincare treatments.
Awesome.
Thank you.
Did you want to add anything?
Well, I just have comments about that. So real quickly, so #1, the reason why you probably don't see those vertical lip lines in men as much is because we shave and we're probably exfoliating, and you just don't see that as much. Even though Hope is correct, we call them smokers' lines. I let smokers believe that that is the cause. I think if there's an opportunity, potentially from a health standpoint, to quit smoking now, especially with that coronavirus, you might be doing yourself some favor. I know smokers don't like to hear that, but I thought I would say it. And then the other thing, just in general, and Karen, I'm not sure, do you have any other questions or not? Well, what I was going to say is this, is we're touching on some of the surface of some of these things. And so if you would like a virtual consultation during this time, we are performing them 7 days a week. They're pretty easy, sort of like this. We'll jump on a FaceTime or Zoom meeting. Interestingly, myself and other facial plastic surgeons around the country are finding that a lot of the ladies that are tuning in this way are hiding their camera. That sort of defeats the purpose of a virtual consultation unless you send us photos, which are fine. We can do that with a phone call as well. But we're happy to do that. The easiest way is just to go to the website, 351face.com. There's a button there, virtual consultation. It bypasses all of the normal patient forms and all of those things. Ultimately, if you come in, we need you to complete that. But we're trying to make it as easy as possible to provide information while we're all hanging out. So, ladies, do you have anything else you'd like to add?
I think that covers most of the questions that we had today. Please keep sending them in. We love answering them. We love spending this time with you. And have a great rest of your day.
Okay, thank you. See y'all later. Bye.